Shoulder elbow division here at Rothman Orthopaedics, I would say, is second to none in the world. The depth and breadth of our coverage as far as the shoulder, the elbow, we've really loved to take care of our patients. It all starts with patient care. We're all focused on that. We've been leaders in development of shoulder replacement. We are cutting edge as far as research and staying on top of our game as far as being leaders in innovation and education around the country and around the world.
So in terms of with shoulder and elbow surgery, particularly as it relates to arthroplasty, we've done a really good job in modernizing our technology. We are beginning to understand the shoulder more and more, and fortunately with technology we're able to fashion components that allow us to achieve the goals that we have set forth as it relates to pain relief and restoration of function.
When you have a subspecialty, what we are doing 24/7 is thinking about shoulder and elbow problems. Our research is focused on shoulder and elbow problems. Our education is focused on shoulder and elbow problems. That's what we live and breathe, and as a result, that's what we're good at treating. I would say that a main focus of our research is trying to objectively look at our complications so that we can better avoid them.
Rothman Orthopaedics had a philosophy that I really embraced: outstanding clinical care, patient-centric care, but also with an eye towards developing the next generation of surgeons. There's a lot of innovation that continues to go on here in the world of shoulder and elbow surgery. So when we look for someone to join our team, we typically ask two questions. Do they want to be innovators and push research innovation to the next level? And do they want to be outstanding clinicians and practice in a tertiary care setting?
We see more patients, we do more procedures, we publish more research than any other place in the world. We train more residents, we train more fellows. We feel very strongly that not only should we be providing the best patient care, but we need to be educating the next generation of surgeons. We train 4 fellows every year and put them out into practice. The shoulder and elbow department is so successful because we have excellent shoulder surgeons. We get together, we talk about the care of our patients. So when you see me, you don't just get my expert opinion, but you get a group of expert shoulder surgeons to talk about your case.
When it comes to doing complex surgery around the shoulder and elbow, you really want people that only do shoulder and elbow surgery. And we're all about that across subspecialties. We want the very best care for every single patient that we treat. And the best way to do that is clearly through subspecialty care.